to this evening's Spring 2022 information session for workforce programs at the College of Staten Island. I'm Lisa Spagnola. I'm the Director of Workforce Development. And tonight I'll be co-hosting the beginning part of this evening's session with my colleague, Jennifer Yip, our Workforce Coordinator. Tonight, Jen and I will provide you an overview of workforce development, explain how our classes run, and then provide you some basic information about 7 of our classes that will be running this semester. Our part of the information session should take about 30 minutes. After that, you'll have an opportunity to go into different breakout rooms within this very session to meet individually with the instructors who are teaching the classes that Jen and I will be giving you overviews about. And depending on what your interests are, you can meet with just one instructor or all 7 of them. And you have 90 minutes to spend as much time as you like in each room, as many rooms as you like. You can ask the instructors individual questions about the programs they teach and the jobs that are related to each program. So if we could move the slides along, let's talk about some things that all workforce programs have in common. You can move that forward as well. All workforce programs are short, affordable training programs that provide individuals the industry credentials that they need in order to be hired for and to perform certain jobs. Industry credentials are a way to let your employer know that you're qualified to do a certain job. So many of our programs also prepare our students not only to perform the job, but to take the related exam. Workforce programs are also usually very small in size, with as few as 4 students in a class to maybe as many as 25. The classmates that you'll meet are diverse in many ways. Everyone will possess at least a high school degree or a GED, but can also have associate's degrees, bachelor degrees, and even above. Some of your classmates will be starting their very first careers, while others will be career changers. And the ages of the students in your class will vary as well. You can be sitting with students anywhere from who are in their 20s to their 60s, but you'll all have one goal in common. And your goal is to find related work to the program that you're participating in. It's also important to note that workforce programs do not provide college credit. Because of that, students cannot use state or federal aid to pay the tuition for the programs. Your tuition is due upfront before you enroll, as you enroll into the program, before you begin. There are other ways, while we can't use Pell and TAP, there are other ways that we can help you to secure supplemental funding for your tuition. Tonight, as each instructor has their own breakout room, you will also be able to speak with our enrollment specialists in the enrollment and registration breakout rooms, and they can also tell you about some ways to pay. It's also important to note that most of our spring classes will be offered either virtually or in a hybrid model. So what does that mean? And let's move forward. Virtual classes are conducted using Zoom, which is the same technology that we're using right now to access this session. It makes sense to offer classes virtually when the related credential doesn't require any in-person classes, and where we've assessed the content in the class and found the quality of a virtual class to be just as beneficial to the student as being in person. If you register for a virtual class, You are required to attend all of your virtual sessions just as you would attend them in person, to be there on time, to stay through its entirety, and your instructor will be there as well. The only difference is that instead of physically taking yourself to 2800 Victory Boulevard, you'll be accessing the class from your own learning space. Some programs are held using a hybrid model, which means that for some classes, you'll complete training virtually, and for others, you physically have to come to a space. And this makes sense either where it's mandated by the related credentialing exam or where you need to practice things hands-on. As I review each program, I'll let you know whether it's held virtually or hybrid. So let's start with our healthcare programs, and then I'll turn it over to Jen to review our social service programs. For each program that I review, I'm going to go over 2 slides. And I encourage you to write, as you hear about each program, to write the names down of the programs that you're interested in learning more about. And this way, when Jen and I are done with our part of the presentation, you'll be able to go right into the classes and start traveling around into the different breakout rooms to speak with as many instructors as you'd like. For each of the programs, the first slide will give you a brief overview of what the job is that the program prepares you for. And the second slide will include some important information about things to consider when determining whether you'd like to enroll in the program or not. Okay, Jen, let's move to the next slide. Okay, so first we're talking about clinical medical assistants. So CMAs typically work in medical offices, urgent cares, and hospitals. And these are the individuals who you see when you're in the exam room before your doctor or healthcare practitioner, right? They'll take and record your vitals. They may take information from you, including what medications you're currently taking, the reason for seeing the doctor. And in some offices, they may even draw your blood or take your EKGs. In other offices, they may also have administrative responsibilities, which can include billing and coding or schedule, making referrals and authorizations. So what things would I recommend that you consider when thinking about whether you want to enroll into our CMA program or not? So when you think of the role, do you like working in a fast-paced environment? You'll also be on your feet, traveling from room to visit with the different patients. So do you like that level of physical engagement in your work? How comfortable are you providing direct care to the sick? And depending on the size of the office, you may wear multiple hats. So how comfortable are you going from providing care to perhaps then doing billing and coding, and then maybe having to do an EKG on someone? Another thing to include, full-time CMAs typically earn around $40,000. Our program meets 3 evenings a week for about 4 months, and our program is delivered in a hybrid method. So most of our sessions are delivered virtually, but in order to we find it best that you complete some skills lab training in person to prepare you best for the role. There's also an in-person CPR workshop. And so let's take a minute to think about what that means, coming to class for CPR and coming to class for the in-person skills labs. Right now, in order to get permission or to get access to CSI's campus, you must be able to provide proof of full COVID vaccinations. And that includes a booster if you're eligible to receive a booster. So think about that as well. And I'd also like to remind you that If the vaccination is part of your decision-making process, if you are pursuing a role in healthcare, it is most likely going to be that you will have to be vaccinated. So think of it not only to be vaccinated for your CPR workshop, for your skills lab, and at the end of the program, when you sit for the CMA credentialing exam, we hold that on campus as well. But you also will most likely need to be vaccinated in order to gain employment as a CMA. Our tuition is almost $3,500, and our classes begin on March 28th. So take a moment now to think about, given all those things, if you'd like to learn more about the CMA program before the night's over. Okay. The next class that I'd like to talk to you about is our phlebotomy technician program. These are the people that most often draw your blood. And they can work in hospitals or they can work in laboratories like Quest or LabCorp. And the primary function of their job is to draw blood, and that can be for tests or transfusions or research or donations. They take that blood, they collect it, they label it, they organize it, and they store it. And if you could remember the last time you had your blood taken, there is an interaction with the client where they're gathering information, potentially gathering payment information before they actually get to the blood draw. So when thinking about whether you'd like to whether you'd like to enroll in the phlebotomy course, the first question is, would you be able to work with blood all day? How do you feel about providing direct care and compassionate care to people who are sick or who may be anxious about having their blood drawn? Very often labs and phlebotomists working in labs and hospitals work in a very fast-paced environment, and they often work non-traditional work shifts, which could mean holidays, evenings, weekends. Phlebotomists typically earn about $50,000, and the training meets 2 evenings a week over 2 months, followed by mandatory clinicals in a Staten Island hospital. And those clinicals will probably take you about 10 weeks to complete, and you're going to different locations. And sometimes you're drawing blood from individuals who are considered inpatients. So they're staying at length for a hospital stay so that you get that experience. And sometimes you're supporting outpatients. The training is partially done through Zoom and then partially in person so that you can practice drawing blood. You're also able to come to an in-person CPR workshop. So again, if you are going to be hired to do phlebotomy work, and in order to come to campus for your CPR workshop or to get into your clinical site, you are going to need to provide proof of all of your COVID vaccinations that you're eligible for. The tuition for this program is about $1,700, and classes will begin sometime in April. Take a few moments now to think about whether you'd like to speak with our phlebotomy instructor after Jen and my presentation. Okay, now we're going to talk about EKG technicians. So EKG technicians operate EKG equipment, and they run tests on patients' hearts and blood pressure. They often then review those images, and they analyze diagnostic information to provide a summary of their findings for the physician. They can work in hospitals, medical offices, and urgent care settings. So when thinking about whether you'd like to enroll in the EKG program, Think about how comfortable you are working with technology and equipment, as well as providing direct patient care, most often for sick patients. It's a fast-paced environment and it's physically engaging. Most of the time, your patient is not coming to you, you are coming to your patient. The salary for EKG techs are around $41,000. Our program meets 2 evenings a week for a little over 3 months, and it's another hybrid program. So as you could start to see, where the programs where people have to learn skills, how to do things. How do you take blood pressure using the cuff? How do you use an EKG machine? How do you draw blood from someone's arm? These skills are best taught in person. And so those parts of the programs are all in person. And our EKG program, our in-person skills labs are held here at CSI's main campus, as well as the CPR workshop. So all of those COVID policies that I told you about the other classes all apply here anytime you're coming to campus. The tuition is about $1,600 for this program, and classes begin March 28th. So take a moment to think about if you'd like to learn more about the EKG program at the end of this info session. Okay, now let's look at dental assistant. Dental assistants perform a variety of patient care, and they can take x-rays, they can do impressions, they prepare patients for treatment, they gather information and records from patients, they can schedule and document patient appointments, and they most often work in dental offices or dental clinics in hospitals. When thinking about whether you'd like to enroll in the dental assistant program, think about the job of the dental assistant, one that has a variety of responsibilities from direct care also to administrative duties, depending on the size and the needs of the office that one works in, but also think about the crux of the dental assistant job. How do you feel about working in people's mouths, right? The salary of a dental assistant is generally $40,000 to $43,000, and our program meets 2 times a week for about 4 months. This is another hybrid program, with the theory being taught using Zoom, and then 2 to 4 in-person sessions at a dental office in order to practice those skills. What I'd also like to note about the dental program is that most of our classes prepare individuals to take a credentialing exam. So for all of the classes that we've talked about so far, phlebotomy, EKG, CMA, there are related credentialing exams. For the dental assistant program, there is no credentialing exam. So when you complete the program, you receive your CUNY issued certificate and you are ready to work. Also, a very favorable time, labor market, particularly on Staten Island, not only for dental assistants, but for all of the programs in healthcare that we're talking about today. Okay, Jen, let's move on. Pharmacy technician. So when you go to CVS and you have a cold and you need to get your medication, this is the first person that helps you at the pharmacy desk, right? So pharmacy technicians help the licensed pharmacists to dispense prescription medication. You give them your written prescription, or they receive an electronic prescription or a refill request. They have to verify information. They can often be expected to prepare bulk medications, fill the bottles with the medications, and then there can be, based on the work environment, an amount of customer service that's involved, because customers who come into CVS expect every person in CVS to know where the products are in every aisle, right? So they may just come over to the pharmacy desk and ask, you know, where the lipstick is. And you can be helping customers in person or by telephone. And most often, pharm techs work at retail pharmacies. So let's think about the following as to whether you'd like to enroll in our Farm Tech program. This is one of those jobs that require extreme attention to detail, right? Regarding prescription strengths, the number of pills that you're dispensing, verifying information. Think of a lot of the responsibilities that we just went through. So do you enjoy a job that requires attention to detail? Do you like working in a position where there's going to be a significant amount of customer service? And during flu season, that's going to be a super fast-paced environment. And it's a somewhat physically engaging job. As you see, they're never sitting. The farm techs are working behind the desk on their feet. Salaries for farm techs are about $38,000. Our program meets one time a week for about 3 months. It's completely virtual, except the in-person CPR workshop, which you can choose to attend. And the tuition is about $1,400. Our Farm Tech programs begin on March 31st. Take a moment now to jot down whether you'd like to speak with our pharmacy tech instructor after the presentation. Dialysis technician. This is the last of our healthcare programs before I turn it over to Jen. Dialysis technicians monitor patients' vital signs and all pertinent information, either on a patient's manual or electronic record. They administer or discontinue dialysis treatment according to established procedures. It's critical to maintain a safe environment, not only for the technician and the patient, but for all the staff in the office. So you're utilizing proper body mechanics, infection control, and cleaning. Dialysis technicians also assist with and perform procedures of equipment maintenance, safe operation, disinfection, and inventory control. And they can work at hospitals, dialysis centers like DaVita, or can go into patients' homes to provide treatment. So I'd like you to think about the following things about the dialysis tech role when thinking about whether you'd like to enroll in this training program. There we go. So like our phlebotomy program, the dialysis tech works with blood and needles. So can you do that? Because that's the bulk of your job. It's also a physically engaging job. There is equipment, just like there is to rely on in the EKG position. How do you feel about working directly and providing direct care to sick patients? And you'll have to demonstrate empathy and understanding because they're in extreme discomfort. Dialysis techs can earn from $35,000 to $58,000. Our dialysis program meets 2 times a week for a little over 3 months. In addition to the in-person CPR workshop, this is a hybrid program. So you are coming in for at least 10 in-person skills labs to the CSI campus. The tuition is $2,100 for the dialysis tech program, and classes begin on April 25th. Take a moment now to write down if you'd like to learn more about our dialysis program later this evening. And now I'd like to move things over to Jen.
Thank you, Lisa. So now I'm going to talk a little bit about the social services programs that we offer. So now let's take a look. So the first one that we have is called Credentialed Alcohol and Substance Abuse Counselor, also known as CASAC. CASAC provide direct care to individuals living with substance use and other behavioral health disorders. They screen, perform diagnostic assessments, clinical evaluations, intake, treatment planning, crisis intervention, and group and individual counseling. They typically work in intervention/prevention programs, medical detox units, inpatient and outpatient programs, and hospitals. So now I'm going to talk a little bit about the role of a CASAC if you're considering joining this training, as well as the training itself. So things to consider if you're looking into CASAC. Do you like working directly with clients towards recovery and wellness goals? Do you enjoy coaching others through positive life changes? Full-time salary for CASACs are between $37,000 to $45,000 per year. The schedule for this, for CASAC, before I talk about the CASAC schedule, actually, this particular training comprises of 8 individual CASAC classes. For the spring semester, we are offering 3 different types of CASAC courses. So in one semester, students can typically take 1, 2, or up to 3 courses during the entire semester. The reason for that is each CASAC class runs just once per week. So one may be on Monday, one may be on Wednesday, and one may be on Thursday. So this is the reason why someone can actually finish the entire series under 12 months. So you can take 2, you can take 3, and within that 12-month period, you're able to complete all the 8 courses, and that will lead up to taking the certification exam with New York State. For this particular training, it's 100% virtual, and the tuition is $500, up to 8 classes that I talked about earlier. So take a moment to consider, would this be the right training for you or the right career for you? Next, I'm going to talk about Certified Recovery Peer Advocate, CRPA for short. So these are people who possess lived experience with substance use disorder, either directly or through a close family member. They provide non-clinical support services to individuals living with substance use disorder. They meet with individuals in different phases of recovery and wellness. They create individualized recovery plans and measure progress against the recovery goals. They also link individuals to social and other services, and they typically work in community-based organizations. Sometimes they also work in hospitals or precincts. Okay, now I'm going to talk a little bit about the CRPA role and the training program. So again, as you're considering CRPA, think about would this be the right role for you after completing the training? Do you enjoy using your experience with substance use disorder to support others? Do you enjoy working directly with others towards recovery and wellness goals? Full-time salary may be between $29,000 to $33,000 per year. This class is to begin sometime in May, but we'll confirm the start date at a later point. It typically does meet 3 evenings per week in a span about two months. The entire training is delivered 100% through Zoom. For this particular program, there is no tuition because this is a grant-funded program. However, Applicants do have to go through a intake process. So the seats offered are determined based on the individual's performance during the intake process. Okay, next, I'm going to speak about community health worker, CHW for short. They assist clients who face difficulties accessing healthcare providers, systems, or medicine due to cultural, language, and/or socioeconomic barriers. They may schedule transportation to appointments for the clients. They may inform and connect clients to resources available to them, instill positive changes in the client's healthcare, navigate and advocate for the clients in complex healthcare networks, and they work in conjunction with the healthcare providers. They typically work in community-based organizations and hospitals. So now a little bit about the CHW role, as well as the training. Do you enjoy supporting your community members? Do you like speaking and advocating for others? Do you enjoy guiding others in their decision-making? Do you like assisting the underserved communities in facing difficulties? The full-time salary would be between $27,000 to $32,000 per year. This training is to start sometime in April, and all the lessons are delivered 100% virtually through Zoom. In a span of 6 weeks, you typically would meet with your instructor 3 evenings per week. The tuition is free to the students. Again, this is another grant-funded program, so there is it's free to the students to attend. However, there is an intake process that applicants have to go through, and therefore the seats are limited based on the person's performance at intake. Okay. Now I'm going to talk a little bit about the breakout rooms. But before I do hope after Lisa and I have gone through the programs being offered this spring, you do have a list of breakout rooms you like to visit or learn more about. So in a moment, we're going to open up the breakout rooms for the classes that we're offering. And I'm going to talk a little bit about how to go about going into the breakout rooms. Okay. So on the screen, you'll see the list of breakout rooms that you can enter. So it's a list of 10 or 11, I should say. There will be 2 breakout rooms for registration and enrollment. So if you're new to the breakout room function, you'll see that there's number one, there's a chat function at the bottom of the screen. This is where you can let us know which breakout room you would like to go into. Either Ismail or myself will move you into your desired room. And at that point, you'll see a little message at the bottom of your screen where it will prompt you to click accept, meaning you're accepting to go into that breakout room. So you can stay in that breakout room as long as you like. Once you've gotten the information that you wish to get, at the bottom of the screen in the breakout room, you'll see a button that says leave breakout room, and you would click on it. And that will bring you back to the main room, which is where we are now. And then you can, again, let us know in the chat box which breakout room you would like to visit next, and we will move you into that room. Okay, so the next steps. If after this session, you have some questions for us, or the following day you want to call and enroll, the number that you see on the screen are the numbers you can call for registration or to ask us questions. So 718-982-2182, or you can call 347-443-9762. You can also email us at continuing_ed@csi.cuny.edu. I do want to note for if you're not able to stay for this entire session, that's fine. We do understand people have time constraints in the evening sometimes. From tomorrow through March 23rd, every day we are hosting a lunchtime session. So if, for example, after the session, you've left and you have some questions for us and you want to speak to someone live in a Zoom meeting, you can come back tomorrow and speak to one of us at the lunchtime session. And that's more of an opportunity for you to ask us questions, because it's more of like a very small Zoom meeting where you get individualized attention. If you wanted to ask me questions about, for example, dialysis, I'm there to answer your questions. And it also gives you the flexibility of attending a Zoom meeting during the daytime. Some people are free during the lunch hours, so that's an opportunity for you to attend as well. So the link is on the screen, and we'll send you this link in a follow-up email as well. And that's it.